The following program is a production of Pioneer Public Television. Welcome to another episode of Pioneer Public TV's examination of public affairs issues as we move around the compass. I'm Jim Thoreen. Each of us experience varying degrees of needed and desired dental health care. These services for rural America face many challenges. Will we have sufficient dentists and support staff within reasonable reach of small communities? Can we in rural areas have access to newest technologies? In this episode, we will examine those issues and other aspects of dental care for small towns and cities. We are joined by two experts in the field of dental care advancements and how we in Western Minnesota gain from their practices. Dr. Jim Zenk has practiced dentistry in Montevideo since 1981. His practice includes 3 additional dentists and a support staff of more than 20 people in his Montevideo and Granite Falls offices. Dr. Zenk is active in the American Dental Association, currently serving as a trustee for the ADA district, which covers Minnesota, Iowa, Nebraska, and the Dakotas. Melissa Jerve is a registered nurse and the office manager for Main Street Dental Care in Montevideo, working with Dr. John Powers and Dr. Barichta, as well as a full staff of specialists. She has coordinated development of a new model of operations for Main Street Dental Care, which we will explore during this episode. So, Dr. Zenk, Melissa, thank you for being here.
Thank you.
Thanks for the invitation.
Well, yes, welcome to Compass. Good to have you here. We'll start with perhaps what I would call the broad brush picture, if you will. How do you summarize your experience and your observations regarding the availability of dental practices for rural Minnesotans, and could you tune in on maybe 1 or 2 of the top challenges? Dr. Zenk?
Well, this is not a new problem. When I came to Montevideo in 1981, a lot of the area towns were starting to lose senior dentists and not being able to replace them. So this has been a challenge for many, many years, trying to entice the new graduates, the new millennials now, to come out to rural Minnesota. It's not a Minnesota issue, as we talked earlier. It's the United States and a national issue to try to get our young professionals, and not only dentistry, but all healthcare, to come out to rural Minnesota and experience what life is like in Minnesota. So we'll talk about what we can do to attract the next generation to come to our area.
Mm-hmm. Melissa, as an office and an RN, by the way, office manager, how do you see the issues from the perspective of your dental office?
Yeah, I would say the same thing as Dr. Zenk said. It's hard to get dentists out here. We've been actively looking with ads and actively trying to recruit for a number of years now with not a lot of success. Dentists are interested in what we have to offer, but to come out here and pick up their family from the cities where there's lots of activities and lots of things for their spouses to do, to come out to the rural areas is a challenge for them.
Now, Dr. Zenk, you were sharing with us, you're a Montevideo boy.
Yes,
okay?
I've moved back to my hometown in 1981.
Now, is that an avenue to approach? Are there people out there who came from rural Minnesota or South Dakota and now can return home and establish a practice there? Yeah. Is that a model?
That's a model that we're using right now. We're basically home growing. Both offices in Montevideo are trying to home grow our own staff, our own teams. And we've been very blessed with that. You go into the schools and you serve in career days and you act as mentors and you invite them to come in your office and shadow you. These are all opportunities for them to explore your profession. But you need to kind of hand pick and look at people that have an interest when they're talking in your office, and look at the best and the brightest kids and try to entice them to go into your profession. And then just help them, support them to go into school and then welcome them back. And we've been really, really lucky in that Our office is basically a team of people from West Central Minnesota and Eastern South Dakota that have come back and stayed in our area. And thank goodness many of them have married farmers, and there's no way they're going to up and leave, the farm. So we've been very, very blessed with our team.
Good work. And Melissa, from the staffing standpoint, getting the correct trainees, if you will, people who have the right perspectives and the right aptitude. You've got that challenge day to day as an office manager.
Right. Yeah, and like Jim said, we do have several people that have advanced their education. If they started from dental assisting and advanced their way up to a dental therapist or interested in going to dental school, we do the same thing. We mentor them. We also mentor the students, or Dr. Powers does mentor the students that are in dental school right now as well. So more of an outreach type of thing, trying to get dentists and dental staff in our area. One nice thing is having the Minnesota West Canby campus dental assisting program close by. We get interns every summer too. So generally they're from the area. There's not a lot that travel to go to school there. So hiring people from the area is our best bet.
Diagnostics for many medical situations for family doctors can be communicated through some real up-to-date technology. A cardiologist in Sioux Falls can talk directly to a patient, and a general practitioner in Canby, for example, they look at a video of the echocardiogram. But to receive dental procedures, I need to sit in a chair with the dentist doing things to improve my dental health. So is there a role for technology today to supplement what you do, to supplant what you do, that allows the patient, me, going in and sitting down and getting work that years ago could never have been done by a local dentist?
I think that's a huge avenue that we need to move more towards. You're right, like an emergency room physician in Sioux Falls could be, or Minneapolis or St. Cloud could be looking at live time what's happening in your emergency room. That can happen in a dental office now with teledentistry, with intraoral cameras, with sharing on the internet. We have lab procedures that we're able to digitally scan into a computer and send that to the lab. We have a lot of new technology, radiographs. The x-rays, we don't go to a dark room anymore and process x-rays. They're all immediately processed digitally. So we have really expanded through technology, but technology is expensive too. So that presents another problem for rural Minnesota, for small practices to try to keep up with technology and to keep layering that technology because it is expensive. And that leads back to attracting young dentists to our area. We have to keep our offices up to date because they expect that technology. They've grown up with technology. They wouldn't know what it would be like to go to a dark room and process an x-ray. They would be totally lost. So I mean, you cannot have a museum anymore. You have to have an up-to-date office. So to be able to attract the next generation to come and replace yourself.
Are there any incentives financially for students out of U of M, for example, or other dental schools to come out to rural areas? Dental school is not inexpensive. And so the students come out and they've got a burden of debt. How do we incentivize them to be out here? Is there some way that the state is or can assist dentists to come out to rural Minnesota?
Yeah, and I don't want to monopolize, I want to have Melissa share in this, but from my experience, there are loan forgiveness programs. The Iron Range has got a fabulous one. We need to model that somehow. The IRRB has got loan forgiveness programs. The state has some loan forgiveness programs for health professionals, but it's shared broadly. Nurses, physicians, optometrists, dentists all can apply for the same loan forgiveness. So that's a difficult one to get. Delta Dental has been kind of exploring, have rural specific students come back to our area. Small towns can make it on their own with economic development coordinators, with mayors, with city councils, making buildings available, low interest loans available. There's a lot of things that these small communities can do to try to attract them, and they are trying to do them. We're very sensitive to the fact that we need to get this next generation out to replace the senior dentists that will be retiring. And unfortunately, a large population of senior dentists live in rural Minnesota. We've been doing our best to attract the younger dentists, but when you look at the dental population in our area, it has gotten to be a little bit more senior.
Oh, indeed. I've experienced that myself. But, so you have the challenge of the dentist getting them to be here. How about on your support side? How about on attracting people who are more advanced in their technology than perhaps when you went to school just a few years ago? But it changes so rapidly. How do you keep up with the support staff?
Yeah, it's ever changing. The support staff, we kept up training and education, continuing education. All of our license require that, so we put all of our team through that. Technology as advances, we advance too. We try to do it, you know, a little bit slower, like digital X-ray, like you talked about, and then the panoramic X-rays, and you know, we advance a little bit at a time. I'd say with all of that. And loan forgiveness programs, they are offered to younger dentists and they all apply, but it's very competitive. There's only so many available. So there's so many, I think at least 3 or 4 people from our office have applied, and usually half get that. So it's
And there's
hard.
other avenues for loan forgiveness. Indian Health Service, I know a lot of recent grads take advantage of that and work for a 3 or 4 year commitment. Military, we have a lot of dental students that sign up for the military and then have 3 to 5 years of service after they're completed their dental school for their scholarship. And we have to remember that those people exist, and that's kind of how we need the community to work together, to come back and tell, you know, when they're at their dental appointments, to share that, say, you know, my cousin, he's finishing up the Army. Do you remember that, you know, he graduated from dental school 5 years ago? He says, yes, let's get his number and let's talk to him. So we need help from other people, because sometimes people just throughout the world, they end up with the military and they would love to come back to this area and raise their family in this area. So that's how the community can help.
Yeah, small community interaction, being close to everybody, and we help each other out.
You seem to have a good model in Montevideo and Granite Falls to be very active and proactive in doing this. So what are you doing differently from, say, dentists in, pick the town, Thief River Falls or wherever that might be?
Well, in my office, that now I have transitioned and I have sold to the younger group, so I'm very happy about that. And now I'm an employee of the younger dentists in our office, but it's been the same. Prevention is basically been our focus. And for us to go forward, and we'll be talking about that, what's next for dentistry, it's all about prevention. We can't continue to chase the disease. We need to get in front of the disease and medically manage the disease, so that we're not, filling holes and, waiting till crises and taking care of that. And I think our area does a very good job with that as far as prevention. But there's so many things that we can do with interprofessional relationship with physicians and nurses and everybody, throughout the town. Teachers getting into the schools, and our schools are really nice about welcoming us into schools. Different programs with new babies, with WIC programs, and opportunities to go talk to young moms. Both Dr. Powers and I work at the outreach for teaching dental students in Rice Clinic and Rice Hospital in Wilmer. And it's all about prevention. It's first tooth. You don't wait till you're 2 or 3 years old anymore. You have them come in right away after birth, first tooth, and talk to the moms. It's not so much for the child, it's for the mom and dad for that education.
So, Melissa, as Dr. Zenk lays out this need, do you find resistance from parents about, oh gosh, we can't afford it, oh gee whiz, it's not that important, oh gosh, I've got to take care of other major things, not dental, with my 2-year-old or my 3-year-old until there's a crisis? Is there any way are you doing things to change that and tell people, yes, you can afford it?
Yeah. I think the education is the biggest part. We talked about earlier about having insurance. People are under the impression if they don't have insurance that they can't go to the dentist, when actually preventative care is much less expensive than having to do the more extensive care. So preventative thing is the biggest thing. Brochures, the ADA makes wonderful brochures. Going into the schools and doing public affairs to educate the moms about what needs to be done and what doesn't need to be done. We have different offices on patient basis that we see, and we see a lot of the Medicaid patients. So by the time we see a lot of these kids, sometimes they're 6, 7, 8, 9 before they actually see a dentist for the first time. And then, we're starting at that point when they already have permanent teeth that are decaying and they're losing all their baby teeth. But at that point, we're starting the education with the child, because the parents are, blaming them, or, the heavy drinking soda or the candy, or, yeah. So education is very important to the population. I'm advanced in my age, but I recall as a child a fear
of dentist because it was going to a dentist equaled pain. And of course now the dentist I see, there is no pain. I mean, it is, a matter of fact, in a root canal I have fallen asleep.
Yeah.
So it's changed so immensely, but do people really understand that? And how do you convey to somebody, number one, the expense, number two, it is not painful?
Okay, dealing with pain, we don't even use that word in our office because it's negative. We're talking positive. We're talking about education. So when mom and dad bring up that word, we just quickly say we don't use that word in our office because the child doesn't know that. They're experiencing that word through mom and dad. So that's one thing that mom and dads can help is saying going to the dentist can be a positive experience, especially when we start them young and early when they have no problems. And we're doing the education, we're teaching mom and dad the nutrition, we're giving them counseling on that daily brushing, daily flossing, and then mom and dads are responsible until that child's 7, 8 years old and can do it by themselves. Yes, the child wants to do it, but mom and dad still have to be in charge.
Are mom and dad seeing to their dental care?
Yes, that is one positive thing that's happened with the Affordable Care Act is most children have an avenue to have some sort of dental insurance benefit. So we're seeing a lot more kids in our office. One problem that we have in our area is a lot of them are on public care programs, and some of the area dentists just can simply not afford to see all the public care because we are reimbursed so poorly. We're reimbursed about 30 cents on the dollar for public care. And when your expenses are 55 to 60 cents, it doesn't take long to all of a sudden you're not paying your bills. Right. So that's one issue. But as Melissa said, education is not expensive. That is probably the most inexpensive thing that we can do. And getting out in the community and having others help us, that would be just wonderful, a much more affordable healthcare program than waiting until something's broken, and then it is expensive to restore.
Are there opportunities from your state association or the 5-state area that you work with to really get out there into the rural areas and expand education, make it easily understood, make it something that becomes a sort of a second nature? Oh, I have to take care of my teeth.
Yeah, and we're trying our best we can, with radio spots, with television spots, but that's expensive. I think it comes back down to the general, you need to do it on a local basis and just in your own office, within your own community, and that's something that we can all do. One really fun program that exists right now is through the dental school. They have what's called a MinCrop, which is kind of like the RPAP program for physicians. Every summer, both Dr. Power's office and our office host a dental student or a dental therapy student, and I've actually had them stay in my own home for the month. And then they're working and they're sharing, and they do a lot of community outreach, because that's kind of what's going to get them out here is the outreach, what they can go out in the community and do. They'll go to the county fairs, they'll go to the WIC programs, they'll go to church groups, to preschool, to Head Start, and just kind of put the fingers out and talk about dental care and preventative dentistry.
What is the single most important thing that our viewers can take away about their dental health care? Whether it would be fear of the actual work being done, or how do I pay for it, or I'm just too busy. What one thing can you implant with them saying dental health care is so much more beyond just your teeth? What do you say to them?
Overall health, I would say it affects your overall health, I think.
So you work with the family physician and your dentist.
Yep, like Dr. Zenk touched on, it's a community effort, from newborns, their first tooth, till nursing homes, working with the physicians or the pediatric doctors, just emphasizing that the overall health is based, on your mouth. That's part of your overall health, and it's very important.
One thing that's kind of happened is dentistry is kind of siloed into just dentistry, but we've got to remember that the mouth is a part of the body, and oral health is a part of general health. If your mouth is healthy, your body's healthy, and that's one thing that we're really trying to move more towards and trying to, as that part of the future. What I talked about is trying to get ahead of the disease rather than kind of chasing the disease and fixing it. We've got to get ahead of that disease. Whether scientists can help us in trying to analyze what our plaque is made up of bacteria and how to fight that bacteria, how to reduce the amount of acids in your mouth. Maybe we can test our saliva to see who's more prone to having cavities, and doing more intentional testing that can be done in our office to say, you really are going to have some problems, through genetics, through your saliva. You're going to be more prone to having cavities, more prone to having periodontal disease. Whereas this person, your saliva tests out pretty good. If you come and see the hygienist every 6 months, you're probably not going to have any dental disease. But you still have to stay with the preventative program. But then we can put more of our efforts in those people that are going to have more of a problem, that we can recognize through some different testing that we're probably not doing enough of right now.
So we have the patient contact, which is essential frequently, so you're proactive. Now, when you're setting out to do that in your offices, you have a massive investment into technology. And we mentioned earlier, this is not inexpensive, but it is a matter of, if you will, keeping up with the Joneses, not only in terms of being current, but also necessity. So you have this great investment, turning things over periodically to make sure. How do you afford to do that, given some of the compensation challenges that you've alluded to?
I'll let you start because I'm kind of monopolizing this conversation here. I don't want to do that, but
Yeah, no, that's okay. I think the biggest thing is we started slow. We gradually, expanded. We talked about, there's some offices that are still, paper charts or older technologies or the old dunking X-rays. We started slow. We slowly purchased it. We went computerless or paperless charts, and then next we did digital X-ray, and we kind of now we just keep going with what technology comes out, and we advance slowly, I would say.
But putting a couple of topics together, what you were saying, the cost of dental education, you are correct. And the average student comes out with a $250,000 to $350,000 debt. That's a big debt. And then if you entice them to come out to a rural area that the office has not kept up with technology, and expect that person to want to work in an office and raise up that level of technology, that also is a big debt. So that's why I'm encouraging our local areas to continue to look at their technology and improve their technology, because that is, but then you have economy of scale. What I see is happening, and is probably going to happen more, is offices are going to group together. And millennials like to work in groups, so you're going to have offices of 2 to 5 dentists in our area, and maybe support 1 or 2 or 3 towns in the area. That the office might be left, and the city is more than welcome to open up that office for you and welcome you there, and the people are there, they don't want to have to drive to Montevideo. I see that happening more, and to try to put a couple of questions together. I think that's going to be our future, is our area are going to be more small group based, just because that's the way our next generation likes to work.
Yeah, and I think success comes from that. There's several dentists that work in your practice, there's several that work in our practice. To be one owner dentist now is hard with the education and the equipment and buying the practice. It's very hard.
It seems to me that you're addressing some of the things that I also wanted to bring into some discussion about having a system that provides services at a, quote, reasonable cost, however you define that, and yet you're in a business to make a profit. And sometimes they're very hard to put together. Mm-hmm. So I think you're describing a model for the future for all of us in rural Minnesota and South Dakota and Iowa that will be probably demanded on us rather than we think it's a nice idea to try. You've got a lot of pressure points.
Yeah, and that we're kind of moving towards in healthcare. We're going to be paying for outcomes versus procedures. And we're trying to figure out, how does dentistry fit into that quality, where you're not going to be paying for specific procedures, we're going to be paying to keep you healthy. Now, how do we get reimbursed for that? That's still to be determined. But I think that's the direction we're going to be going. And that's where prevention leads into that so much with dentistry, because it is a preventable disease. The disease that we deal with most of the time is caries, decay, or periodontal disease, gum disease, and that is preventable. So how do you keep people healthy, your population? Because I think we need to go from individuals to populations, and how do you keep a population, how do you keep West Central Minnesota healthy? Right. So that's kind of where I see the future going.
Wonderful, wonderful. And so many, we've touched upon a bit of the huge problem, but we've got a starting point, and that your offices in Montevideo and Granite Falls are proceeding as you are. Sounds to me like we've got some leading models that can help the rest of rural Minnesota and the Dakotas and Iowa and Nebraska, all facing some of the same challenges. So you bring to us a lot of insights, foresights, and in coming months, perhaps we'll have you come back and give us updates, what's going on in rural dentistry.
Love to.
Yeah.
Yes.
So Melissa, Dr. Zenk, thank you so much for joining us today. We really, truly appreciate your expertise and your insights to ensure that rural areas will continue to receive dental health care services. You've relayed to our viewers our many challenges and opportunities. Most importantly, thank you to our viewers for joining us, and thank you for your support of Pioneer Public TV. Until next time, live fully your 360 degrees. Have you missed an episode of Compass? Every episode is available to watch free online at video.pioneer.org or on the PBS Video app. And keep up to date with the latest Compass happenings on our Facebook page. Search Compass on Pioneer on Facebook and hit the like button. Minnesota's court system is often held as a national model for complete justice for all. Join Les Heen as he gains insights from Supreme Court Justice Barry Anderson and District Judge Amy Dahl on the next episode of Compass.